is silent threat. How stray dogs accelerate antimicrobial resistance, posing a grave global health crisis. I am Maya, the first AI-powered health assistant created by Dr. Kadiyali Srivatsa, the pioneer of digitalizing patient-centered care, warning Indians about urgent global health and socioeconomic crisis, threatening to reverse many of the gains made in modern medicine. This phenomenon occurs when microorganisms like bacteria, parasites, viruses, or fungi develop the ability to survive in the presence of antimicrobials, rendering common treatments ineffective. While AMR is a complex problem driven by the misuse and overuse of antimicrobials across various sectors, including human medicine, agriculture, and livestock, emerging evidence points to stray animal populations, particularly dogs, as significant reservoirs and vectors in its spread. The interconnectedness of human, animal, and environmental health, often referred to as the One Health approach, is crucial to understanding and combating this escalating threat. Stray dogs are potent reservoirs of drug-resistant pathogens like E. coli and Candida auris that spread to women, children, and the environment. This potent reservoirs of drug-resistant pathogens colonized in Bangalore, India, is likely to destroy lives of millions of Indians. I was shocked when people feed and allow children to play with them. When I requested the people not to feed and stay away, the very people whose life is at risk were abusive. Thanks to the High Court in Delhi, and I hope the law will be enforced in the country soon. Studies have isolated a variety of multi-drug-resistant (MDR) bacteria from dog fecal samples collected from urban streets. These include 1. Multi-drug-resistant enterococci and methicillin-resistant Staphylococcus aureus, MRSA, a significant 65.7% of Enterococcus spp, isolated from dog feces, exhibited high-level aminoglycoside resistance, HLAR. MRSA strains isolated from pets have been observed to resemble those found in hospital settings, suggesting potential transmission between animals and humans. 2. Escherichia coli, EC, and Klebsiella pneumoniae, KP strains that are multi-drug resistant and produce extended-spectrum beta-lactamase, ESBL, AMC-beta-lactamase, and metallo-beta-lactamase, MBL, including those carrying BLA-NDM1 and BLA-NDM5 genes. Research indicates a considerably higher prevalence of multi-drug resistance in E. coli strains from stray dogs compared to owned pets. 3. Colistin-resistant E. coli carrying the MCR1 gene, an antibiotic of last resort, have been identified in stray dog fecal samples. The drug-resistant yeast Candida auris, recognized by the World Health Organization, WHO, as a critical priority. Fungal pathogen due to its resistance to common antifungals has been isolated from the ear canals of stray dogs. Researchers suggest these dogs could serve as transmission vehicles to other animals and humans. Remarkably, these drug-resistant pathogens have been found in stray dogs even without a history or scope of prior antimicrobial therapy, highlighting the role of the environment in the spread of such pathogens and the further possibility of human infections. Pathways of transmission to humans. The close interaction between dogs and humans, both direct and indirect, creates an ideal bridge for the interspecies transmission of AMR bacteria. 4. Direct transmission occurs through close physical contact, such as petting, touching, kissing, or licking. Behaviors like allowing dogs to lick faces and handling dog feces have been shown to contribute to AMR bacterial transmission. 5. Indirect transmission largely involves environmental contamination. Bacteria can spread within shared living environments. Dog feces, if not properly managed, can contaminate urban spaces, acting as a reservoir for antibiotic-resistant bacteria. Moreover, practices such as stray dogs breaking garbage bags and consuming waste, or household antibiotic waste contaminating the non-home environment, can select for and spread AMR genes, which then infect stray dogs and subsequently humans. A dire public health crisis will occur because the implications of AMR are staggering and far-reaching. In 2019 alone, an estimated 1.27 million global deaths were directly attributed to drug-resistant bacterial infections. If left uncontrolled, AMR is projected to cause 10 million deaths annually by 2050. The economic toll is equally severe, with estimates of $1 trillion to $3.4 trillion in annual GDP losses by 2030, and an additional $1 trillion in healthcare costs by 2050. AMR threatens to make common infections untreatable and renders routine medical procedures, such as surgery and cancer treatment, unsafe. This means that once minor ailments could become deadly, placing an immense burden on health systems and complicating responses to future health emergencies. The global health impacts of AMR are already on par with major diseases like HIV/AIDS and malaria. The uncontrolled spread of highly resistant pathogens from stray animal populations exacerbates this crisis, creating the potential for epidemics that could have catastrophic consequences for human health. India's unique vulnerability, facing a particularly acute challenge due to its vast stray dog population and the high incidence of dog-human interactions. 1. India has the highest number of stray dog attacks in the world, with over 3.7 million reported dog bite cases in 2024 alone. Children are disproportionately affected, accounting for up to 40% of bite victims in rabies-endemic areas. 2. India accounts for over one-third of global human rabies deaths, with estimates of 18,000 to 20,000 fatalities annually, 96% of which are caused by stray dogs. Rabies is nearly 100% fatal once symptoms appear. 3. Beyond rabies. Unchecked dog feces in urban areas contributes to other zoonotic diseases like leptospirosis and Campylobacter, particularly aggravated by contaminated water systems during monsoons. 4. Despite the existence of a National Action Plan, NAP-AMR, based on the WHO's Global Action Plan, its implementation in India has been stymied by insufficient budgetary allocation across states, lax enforcement, and inadequate multi-sectoral coordination. Current policies, such as the Animal Birth Control ABC rules, make it difficult to remove even dangerous or repeat offending dogs from public spaces. The imperative of a One Health approach addressing the AMR crisis, especially as it relates to stray animal populations, necessitates a comprehensive One Health approach. This involves a joint, multi-sectoral effort among disciplines concerned with human, animal, and environmental health. Key strategies include promoting global public awareness campaigns about the dangers of antimicrobial overuse and misuse, improving and strengthening hygiene measures and infection prevention across all settings, from healthcare facilities to communities, reducing the unnecessary use of antimicrobials in agriculture and their dissemination into the environment. This also includes controlling irresponsible antibiotic sales and managing household waste effectively. Enhancing global surveillance of drug resistance to gain a clear understanding of current data, mechanisms of resistance, and future threats. This requires integrated surveillance systems covering antimicrobial use and consumption in human and animal populations, promoting new and rapid clinical diagnoses to ensure appropriate antimicrobial prescriptions, building a global coalition for action and securing sustained investment in research and development for new treatments, diagnostics, and vaccines, while ensuring equitable access. Implementing responsible pet ownership through education, vaccination, and sterilization programs, and preventing the abandonment of pets. Without a coordinated, multifaceted approach that recognizes the interconnectedness of all living systems and their environment, the world faces the prospect of untreatable infections leading to millions of deaths, crippling economies, and undermining global health security. The time for decisive action on AMR, starting with comprehensive management of its environmental reservoirs like stray animal populations, is now. My app Maya AI will be released soon in Google Play and App Stores. Please follow and share and get free download if you follow my podcast, LinkedIn, or join WhatsApp group. Please visit website drmayagpt.com. Thank you.